Welcome back to our Missi Online Health Talk. October has been always called Pink October because October we used to call Breast Cancer Awareness Month. So it's Pink Ribbon Month in other words. So today, Missi Out the Love will go through awareness facts for breast cancer. So before we understand what is breast cancer, we look at the structure of the breast. As you can see from here, the slide here, basically it's formed by the ducts and then connected to all the lobules here. And most of the cancer come from here when the breast cancer occur when the cell in the lobules or the ducts become abnormal and divide uncontrollably. And these abnormal cells may eventually invade the structures nearby, like for example, fat tissues, muscles, and spread through blood vessel and lymphatic nodes, a channel to other places like, for example, lymph nodes, lungs, bones, brains, and liver. And there are various types of breast cancer. However, majority, 80% of the breast cancer actually come from the milk ducts, as we mentioned earlier, or lobular, milk-producing tissue. As you can see from here, if it's still early stage, without spreading or invading the nearby structure, we call it very early stage of the breast cancer or in situ, ductal carcinoma in situ. If you involve lobule, you call it lobular carcinoma in situ. But if it starts spreading to the surrounding tissue, then we call it invasive ductal cancer or invasive lobular breast cancer. And the other two quite common type are inflammatory breast cancer and Paget disease. However, 80%, as I mentioned earlier, actually come from the ducts or lobules. Either type, as mentioned, if it's early, we call it in situ. Now, some statistics about breast cancer in Malaysia. It's the commonest cancer affecting women in Malaysia, and about 1 in 20 of women in Malaysia will have the chance of getting a breast cancer in a lifetime. That's very high. And look at the ethnic structure. Indian and Chinese stand a higher chance with 1 in 16 each. However, Malay has a lower incidence with 1 in 28. And all the breast cancer reported in Malaysia, 64% occur between the age of 40 to 60. Unfortunately, nearly 40% of the cases identified each year are already in a very advanced stage. And more statistic when, as we mentioned earlier, breast cancer is the most common cancer in the Malaysian female and stand about 1/3 of all the cancer in female. And 5-year death rate is as high as 33%. However, in all these death rate, 88% of them actually is avoidable. And why is avoidable? Because 43% of them didn't have access to the optimal treatment. And as many as 57% or more than half, actually they presented very late. And they can talk about average 3 months from the first symptoms they are aware of, first signs they have aware, until the day they call for help. It may take about 3 months. And 3 months is quite long for any cancer. And less than 30% of the female in Malaysia went for their yearly screening over the last 10 years. And the screening rate is very low. And what are the risk factors? You can divide into this part called uncontrollable risk factors. The other part is called controllable risk factors. Uncontrollable, this means we can't change much. Whereas controllable, we can do something and change the risk factor and reduce the risk factor. Uncontrollable one, for example, is more prevalent and very common in female compared to the male, the gender difference. And as we age, of course, especially after age of 40, the chance of getting breast cancer is going higher. And 5-10% of cases actually have genetic factors and comes from the family history. And before they have the early menarche, means that the period come early before 12 years old, or they have a late menopause after 55. And they have previous radiation to the chest wall. For example, those patients with the lung cancer, they have the radiation, then you can see there's a increased risk of the breast cancer. Those with the controllable risk factor, like for example, having no children, giving birth at an older age, no breastfeeding, using hormone replacement therapy, for example, after menopause, using hormonal birth control methods, eating lots of processed food and fatty food, lack of exercise, and obesity, particularly after menopause. All these are the controllable risk factors. What are the early signs or the symptoms of breast cancer? As you can see from here, if there's a particular pain or spot in the breast tissue that does not go away, swelling, warm, redness or darkening of the breast, change in the size or shape of the breast, dimpling or buckling of the skin, itchy, scaling, score or rashes on the nipples, nipple discharge that starts suddenly, pulling in of the nipple or other parts of the breast, lump, hard knot or thickening inside the breast or underarm area at the armpit area. So if you look at the illustration in lemon here, you can see here, feeling a thick area, is dimple going in, you can see the nipple crust, red or hot over this certain area, and some discharge here, a skin sore, hard lump, like orange peel skin, irregular and hard surface, and abnormal shape and new lump coming up, bulging out, and the sunken nipple. Now this sunken nipple means that previously was normal, suddenly it retracted in. Growing vein, you can see abnormal vein growing on the breast, or some bump protruding out. All these are the warning signs that we have to look out for and call for help early. And what are the investigations that doctors do? We usually subject our patient to ultrasound or mammogram. Now mammogram, most accurate method of detecting non-palpable lesion, show lesion and cancerous changes such as microcalcification. Ultrasound may be used to distinguish cysts from the solid masses. At the same time, doctor will do estrogen and progesterone receptor marker. We also do some tests, including liver function tests, to detect any liver metastasis, calcium alkaline phosphatase to detect any bone metastasis as well. And eventually, we may have to do fine needle aspiration or biopsy to take out the cells and send to the lab to examine under microscope to determine which type and how aggressive it is and whether it's invading the nearby structure. And we'll proceed with CT scan as well, whole body scan, to assess whether the lesion has spread to the lungs, bone, liver, etc. Now, after all the diagnosis and after the operation, we'll stage the tumor in order to tell the patient the prognosis, the future of it, the outcome of it. We also want to see what chemo and what modality of treatment will be given. So it's stage 0 to 4 here, as you can see, and it depends basically on the tumor size, whether there's lymph node involvement, whether it has spread to other organs. And look at the stage 1, it's usually very small lesion, no lymph node involvement. Whereas come to the stage 2, the tumor size has grown slightly bigger, 2 to 5 centimeter at this stage. Then the lymph node already affected by these cancer cells. However, he has not spread beyond breast tissue. Stage 3, again same thing, just that the lesion at this stage is 5 centimeter or larger, and not only affected the lymph node, but also reached the muscle and the skin around that area, and is still confined to the breast tissue. Whereas stage 4, he has spread to other parts of the organ, for example, bone, lungs, and liver. And look at the bottom part here is 5-year survival rate. It differs so much from 100% dropped tremendously to so low at 20% for stage 4 disease. So you can see that if we were to be able to pick up early stage disease, like for example 0, 1, and 2, the survival rate is very good compared to a late detection. That's why early detection is important, and that's why we have this Pink October to create awareness for early detection. The treatment, since today the topic is on awareness, won't touch much on the treatment option. Basically, it's divided into local or systemic. Local, for example, surgery, radiation, and systemic will be hormone therapy, chemotherapy, and targeted therapy. Sorry, there's a spelling mistake here. Of course, we want to know in this campaign how to prevent it. It's suggested that exercise can reduce the risk of breast cancer as much as 1/3. Regular exercise, healthy lifestyle can also improve the outlook of people affected by breast cancer. And if you've gone through the menopause, you have to be particular about the weight. We can't get overweight or obesity. Because this overweight creates more estrogen to be produced, and this indirectly will cause increased risk of breast cancer. Besides this, we have to limit the amount of alcohol we drink. Nurse baby, if you have one, so that breastfeeding is important, it will reduce the risk of breast cancer. Avoid birth control pill and find out the risk and benefit of all contraceptive methods before deciding what to use with your doctors. And avoid hormone replacement therapy if necessary. That have to discuss with the ONG specialist which is suitable. Breast cell examination also is a very good method of prevention, and we have to do it while lying down, while standing, look at the mirror, and has to be performed monthly basis, and it's good to do at the end of the menses. And these are the few things that we look for during the breast cell examination, like wedges, and examine mirror for lumps or skin dimpling, change in the skin color or the texture, then examine the breast with palms at the armpit, look up and down, and then you circle in the movement of the hand, and look at symmetry, whether both breasts whether they come in symmetry now. And we won't touch much on the breast examination. Everyone knows there are so many videos available where you can access and then learn how to do a proper breast cell examination. Next, talk about the mammogram. It doesn't prevent breast cancer, but they can save life by finding breast cancer as early as possible, and that translates into reducing risk of dying from this disease by 20 or 30% or more. Early detection is the best prevention. It can detect abnormal breast tissue approximately 2 years before it becomes cancerous. Mammogram also improves the chance of breast conservation. Early detection of localized breast cancer lowers the chance of needing a mastectomy or breast removal. It's also a very fast procedure, about only 20 minutes. Discomfort is minimal for most women. The procedure is safe. There's only a very tiny amount of radiation exposure from mammogram. And every woman should have a mammogram as early as age 40 and yearly if possible. Conclusion: breast cancer is very common. Early detection can save life. Prevention starts from today. Mammogram and breast self-examination are both important. All right, thank you.